I've been asked, well, I won't say anything more about myself. I work in the Commission DigiSanté in the unit that deals with health technology assessment, or HTA. I've been asked to say something about the implementation of the EU regulation on HTA. I think it's important to say that the regulation builds on a long experience of voluntary cooperation in the field of HTA in Europe through the joint actions, UNETA, and also from with the arrival of the directive on cross-border healthcare, the Commission also established the HTA network. And some of you may be familiar with the stakeholder pool that was also established under the HTA network. Why I think it's important to say this for two reasons. One, because we are at the EMA, and UNETA and EMA have a solid cooperation, have been having a solid cooperation for years now. I'm sure Michael can say more about this, or the colleagues. And secondly, because what we have done in the past, so the methodologies and the guidelines and all the work that was developed in the past now has in a certain way to look at the future and to be adapted to the new system. I'm sure a lot of you are familiar with the UNETA core model of the 9 domains of an health clinical technology assessment. I want to, but I think it's useful to set the scene and to always say at the beginning of the presentation that the EU regulation on HTA only deals with the first 4 domains in light blue in this slide, so the clinical domains. While the other domains in red, the so-called contextual domains linked to social, economic, ethical, and other aspects are dealt with at the national level, so by member states. It's important to understand that member states have an important role to play with the regulation because the main governance body created by this legislation is the coordination group on health technology assessment, which is composed by...
Apologies, there are many comments in the chat box. We can barely hear the speaker.
Okay.
Thank you.
So maybe, Valentina, just try to be closer to the mic, if you can.
Okay, I'm gonna move a bit. Can you hear me now? Better?
Very well, thank you.
Okay. So I'm sorry for this. I'm just saying that there is an important role for member states now that we have a legal framework on health technology assessment at the European level, because the coordination group on HTA, the main governance body under the regulation, is made up of authorities from member states. These member states will also designate their members and representatives in the 4 subgroups foreseen under the regulation. You can see them in this slide: the subgroup on joint clinical assessment, the subgroup on joint scientific consultations, the one dedicated to the identification of emerging health technologies, and the one on methodology. I don't want to go too much into the details here, but I want to stress that the Commission is playing an important role as a secretariat to the coordination group, and therefore providing administrative, technical, and IT support to the coordination group and the subgroups. It's also key to understand that one of the main innovations of the regulation is the formalization of the interaction with stakeholders through the creation of a stakeholder network. And here again, in this slide, you can see the 4 main pillars under the regulation. So we have the core element, the joint clinical assessments. The regulation does not deal with every product. It has a limited scope. Certain medicines, only the most innovative products going through the centralized pathway through the EMA will be the focus of the regulation. So some medicines with a so-called stepwise approach. So first we will see oncology medicines and advanced therapy medicinal products under scope, later on orphan drugs, and in 2030 the regulation will reach its full scope. And a number of high-risk implantable medical devices will also be covered by the regulation. Then we have the joint scientific consultations, the so-called early dialogue, scientific advice provided by HTA bodies to guide developers in the generation of evidence, which can also be done in parallel with the EMA. And I'm sure the colleagues from EUNETA 21 can say something more about this later. And then we have two different types of activities on point 3 and 4, the work on horizon scanning, on emerging health technologies, and the work on methodologies. Here, I just wanted to highlight that the engagement with patients and healthcare professionals is has to be understood in two different ways under the regulation. So the product-specific outputs, the joint clinical assessment and the joint scientific consultations foresee input from experts, from individual experts, being them patients, clinicians, or other experts, while the domain under 3 and 4 in this slide foresee input from organization through the stakeholder network. Where are we in this moment? We are in the preparatory phase for the implementation. So the Commission is very busy on a number of different tasks. And here I just want to mention the setting up of the entire governance structures under the regulation. So the coordination group, but also the subgroups. And the work that we are doing to the service contract EUNETA 21 to, like I said at the beginning, to be sure that the methodologies that came out of Joint Action 3 are fit for purpose for the new system and can provide a reasonable input to the work of the coordination group. But I want to focus here for the meeting today on two things. The fact that the Commission will have to adopt implementing acts under the regulation. As you know, the regulation is a general, provides for the skeleton of this system is quite a detailed one, but still a lot of elements will have to be discussed and detailed in implementing acts. And some of these elements relate to the interaction and the selection and consultation of experts in both joint clinical assessment and joint scientific consultations. And the second aspect that I wanted to focus on is the stakeholder network, because the Commission will launch an open call for applications by the end of this year to set up the stakeholder network. You have a lot in the regulation on this. We have an article 29, that details quite a few aspects. So the call will basically follow the structure of the regulation. It will be open to all eligible stakeholder organizations, so including patient associations, consumer organizations, health professionals, non-governmental organizations, and so on. It will be important to respect the eligibility criteria that are also detailed in the regulation. And in particular, I want to maybe say a couple of words on the proof of engagement in HTA, because it's important that this stakeholder network provides input to the work of the coordination group and its subgroups. So in the selection of organizations, we will take in account the previous experience in the field of HTA, which can be proven by having written articles or having had working groups on this topic, having participated to EU-funded actions and so on, whatever you can have to prove that you can provide added value to the discussions. And then, of course, organization will have to declare their membership and sources of funding, and the individual representatives will have to declare their financial and other interests. And I think I'm more or less on time. I wanted to conclude with coming back to what I said at the beginning. One of the most important innovations under the regulation is the inclusiveness and transparencies. These are key principles of the EU joint work. We have 2 years ahead of us until the application date, as the regulation will apply from January 2025. We are creating a system not alone, but co-creating with all the stakeholders. And it's vital, the commitment of patients and healthcare professionals for the implementation and to secure the system that we have, all of us have dreamt of. As I said, organization can apply to the stakeholder network, while individual experts will be asked to provide input on joint clinical assessment and joint scientific consultations. I leave you here my contacts and the contacts of the team. Please do not hesitate to be in touch with us. And I understand there will be a Q&A session afterwards. I'll be happy to listen to any kind of comment or remarks and to also any question you may have on your side. I cannot promise you that I will have the answer to every concern, but I'm looking forward to hearing them. Thank you.